Hello everyone, welcome to another episode of the Sleep Lab Stories. My name is Marianne, I'm your host. If you're new here, thank you for choosing to spend this time with me again, or rather for deciding to spend this time here. And if you've been here before, welcome back, and thanks for the consistent support and coming over again. Remember to subscribe, like and share this and any of the episodes if it is concurring with what you're going through, or if you know anyone who it can be of benefit to. I also offer one-on-one sessions, so if you're interested, you can book a slot via my calendar. It's on the website, which you will find. I will link it up in the comments below. So today we'll be talking about sleep across the lifespan, with the main focus being on children. That's where we all begin, and we will explore how sleep evolves from infancy to older adulthood and why it matters for health, learning and overall well-being. So we will dissect the common pediatric sleep disorders, how they are diagnosed, and what treatment options are available. Yeah, that's all I'll have in this episode. I will have a series of this sleep through the lifespan, which will also look into their different stages of life on the coming episodes. Sleep supports brain development, emotional regulation, learning, memory consolidation, immune health and growth. And these are all core areas of development throughout infancy, making sleep actually essential. Studies suggest that 20 to 30% of children experience sleep difficulties at some point, which is actually quite a significant number if you look at it from like every 20 out of 100 children, or rather 20 to 30. That's a lot, and that's also a huge number of families which are affected. Today we'll explore normal sleep patterns in children, the most common childhood sleep disorders, and the diagnostic methods applied, as well as the treatment options available for these disorders in children. To begin with, what actually does normal sleep look like in children? And what does it even mean to say normal, Newborns typically sleep around 14 to 17 hours per day. And if you've had any experience with newborns, these are spread out across the day. Like they'll be sleeping and waking, and in between short periods where they feed. And this also even happens at night. Like they don't have that sleeping throughout pattern yet while they're newborns. And by the time they are in the preschool age, the sleeping time goes down, because they need to sleep longer. The development, the catching up also is less, because they're catching up. They can sit, they can walk, muscles are building up, which is what takes most of their energy, and they need to have more sleep. So in preschool age, the number of times that kids need, hours, is approximately 10 to 13 hours per night, often with naps, although the naps disappear gradually. By the time they join school, they need around 9 to 12 hours of sleep. And teenagers require 8 to 10 hours of sleep. Though these look different in reality, especially in the phone and social media era, which I feel like this pressure to sleep is, to miss sleep is higher than the pressure to sleep, although biologically teenagers do need more sleep. children cycle through two main stages: the REM sleep, which is the dreaming and brain development, and the non-REM, which supports the physical restoration and growth. Disrupted sleep affect mood, attention, behavior, and academic performance. My mentor was actually telling a story how he would wonder why kids who are performing well also seemed to have like good features and like appeared more stable, which is also one thing. Like the facial structure and at times the bone structure of the face can already sometimes tell if there is disruption, or rather the developmental physiology of the kids, which includes the airways, the mouth, nose. They affect the breathing and sleep in general. So there is a way, especially in kids, where their facial structure already more or less can tell the quality of the sleep that the children have. And now moving on to the next point, which is common sleep problems in children. The first common sleep problem is the behavioral insomnia. This is usually noticeable during sleep onset or before bedtime. Children associate sleep with certain rituals like being rocked to sleep or having a parent present. When they wake up at night and not find these same conditions or rituals, they struggle to fall back to sleep. And also common are the delayed bedtime, when kids repeatedly ask for stuff or resist to go to bed due to inconsistent routine or rules. But this could sound, it's not supposed to be like a critic, but it's a learned behavior. The children learn that, okay, if I ask for more, I get more time, I get more attention, and with time they do it repeatedly, which is a cycle that can be broken. And how is this, like the insomnia, diagnosed in children? Mainly this behavioral insomnia is diagnosed mainly based on sleep history, which is mostly gotten from the parents, the bedtime routine, the parent interviews, and the sleep diaries, which are recorded again by parents mostly. And this can show a pattern in how the kids go to bed or how they stay awake. And here I would like to encourage the parents to use all available tools like phones to document. If you notice that your child is delaying their sleep time or they're getting late and late, you can just document the patterns and you can notice whether it's about something they need or it's the routine that they get, and that can also be helpful to see where to break the cycle from. What treatment options are available for this behavioral insomnia? The focus is mainly on behavioral strategies, like I've already mentioned. So a consistent bedtime routine would be very useful. Gradual withdrawal of parental presence, because if you're already training, for example, the child to sleep on their own or to sleep in their room, it's helpful to maybe make the times where you take them to bed shorter and shorter and shorter, and eventually just make them go alone and just maybe away from the door. Do it gradually, don't just do it once, because that will also make them not get the pattern not last longer. And also controlled comforting, which is you can go with them when they need something, but not overstay or not sleep along with them, because again, if they see you sleeping with them, they'll fall asleep quick, but if they wake up at night and not find you, they will struggle to go back to sleep. Medication is rarely recommended for this. So yeah, those the behavioral strategies are the main ones. OSA is the next common sleep disorder in children, which is obstructive sleep apnea. This is when the airway is partially or completely blocked during sleep. The symptoms are loud snoring or loud breathing, pauses in breathing, mouth breathing, restless sleeping, daytime sleepiness, hyperactivity, mood swings, learning difficulties. And also, if you notice that your child sleeps with their head stretched backwards, that could also be a sign that they are trying to elongate their airways to get more air. And at times also with the breathing, I would like to emphasize that with kids, the sound of their breathing should be really hard to know. Like if you enter a room where a child is sleeping, and the lights are out, you should actually struggle to find where the child is. But if you enter a room and can hear the child's breathing sound, that should already call for a watchful observation. So you need to just watch how this progresses or develops with time, that you sneak into the room when they're sleeping to hear how their breathing progresses. And that can be very helpful. And the breathing in children I wanted to demonstrate is usually, could be even something like that's already enough to give a hint that they could be struggling with their breathing. So a watchful observation is the tip I would give on that. The most common cause of obstructive sleep apnea in children are enlarged tonsils and adenoids. The diagnosis for this is usually a polysomnography study, so a sleep study, which currently can be done both in a lab and at home. There are currently really good tools that can be used at home to do this. Treatment option, the first line of treatment option to OSA for kids is adenotonsillectomy, which is the shaving or complete removal of the adenoids and tonsils. Weight management can also be factored in case obesity is a factor, because OSA, the same way in adults, it's mostly also perpetuated with obesity, can also be a problem to children. And in persistent cases, the kids can also be introduced to CPAP, or rather the cases where kids end up using CPAP can be varied. Maybe there could be still no, if they're not stable enough to go through surgery, or if there may be other underlying conditions that could still not give them the benefit when they go through a surgery. So this using a CPAP can also be an option. Another common sleep problem in children are parasomnias, and these are unusual behaviors that occur during sleep. They are common and harmless, and the common examples are night terrors, which is sudden screaming or fear. Children wake up. Sometimes they are not conscious, or rather most of the times they never have the memory of the event. And sleepwalking is another one, where walking in sleep occurs in non-REM sleep. And that's why, because in REM sleep the muscles should be lamed. So sleepwalking mostly happens when the muscles are still active. Confusion or arousal, when the kids wake up disoriented and not looking like they are aware of their environment. Their diagnosis for parasomnias: clinical history and parent interview. Treatment options: adequate sleep, safe sleep environment, scheduled awakening for frequent episodes. Because I had a case where someone had noticed their child always having this 2 hours into their sleep. So the best tactic was to wake them up shortly before that so that you can break the cycle before that. Like, not really completely wake them up, like be around them, make them aware, like 2 hours into their sleep. Mostly if kids sleep earlier than the parents, you can't be in a position to do that, and then the kids continue with their sleep. The other common sleep disorder in children is restless leg syndrome and periodic limb movement. This involves uncomfortable sensations in the leg, creating an urge to move. And this worsens at midnight, because at night, that's when you're supposed to be like resting, the legs are not moving. So this urge worsens when that kind of calmness sets in. Symptoms: difficulty falling asleep, nighttime restlessness, daytime fatigue, which is actually a cause of poor sleep at night, and behavioral concerns. Diagnosis for restless leg syndrome or periodic leg movements: clinical history, family history, iron level testing, and sleep studies where the muscle activities of the leg are on main focus. And treatment options are iron supplements if iron deficiency is detected, sleep hygiene improvement, and also rarely there could be other medication administered, although this is very rare. The other sleep disorder in children: circadian rhythm sleep disorders, and this is mostly in adolescents. Children may develop delayed sleep-wake phase disorder in their adolescence due to many factors. Like I mentioned before, in this current social media and screen time era, they could have more urge to stay on the screens. At times, even with restriction, maybe they find how to hide or do something, or just generally hanging longer on the screen than they should. This ends up with time shifting their circadian rhythm, and also generally maybe just habits of hanging out longer, doing things out longer with friends can lead to this shift. Diagnosis is done mostly through a sleep log or a diary and actigraphy. Treatment: gradual sleep schedule adjustment, morning bright light therapy, which means the first thing in the morning, expose yourself to the natural light instead of the artificial light on the screen. And then limit evening screen time exposure. And also in some cases, there could be admission of melatonin under supervision. So when do caregivers and parents need to seek help when they suspect that their children have sleep disorders? When there is observed persistent snoring, loud breathing or breathing pause, severe bedtime resistance, frequent night awakenings, excessive daytime sleepiness, development of behavioral changes, safety concerns related to night terrors or sleepwalking. So, any observation you could be making on your child that could make you feel that something is wrong, mostly your instincts could be right, and it's best to have it checked by a specialist, because most of the disorders in children can be treated. How to promote healthy sleep in children: keep consistent routine at bedtime, calm bedtime routines, screen-free wind-down period, comfortable bedroom and environment of sleep, age-appropriate sleep duration. Like, don't make these kids maybe who don't need to sleep long, don't take them to the bedroom too early, because eventually they will develop what looks like insomnia, but not. And also encouraging daytime physical activity, and not just inactive or like activities that make them not feel tired, because their body needs that. The body needs more movement, I mean, this is not only for children, but even in other, but today the focus is on children. Encourage them to do physical activities, because this also activates their body to activate the other processes, which includes initiating sleep on its own. Understanding these disorders helps families seek timely support and improve not only the child's well-being, but that of the family as well. I hope this episode has you've taken something along with you, learned something new, and I'm grateful for joining me on this episode once again. And don't forget to share if you know anybody who could be needing to hear this, or who the information can be useful to. Leave a comment also if you have your experience with kids, or your own, or kids you've taken care of, how you went about it, and which tips helped to go through that stage, whether with sleep disorders or in when the observation, what you did, which steps you took, and how it ended up. I would really like to hear different experiences. And till next time, I hope you take care, and I encourage you to watch out for a couple of events I'll be posting upcoming, and I will either post the direct links, the live upcoming end of this month. That would be very interesting if you can join them on live, or if you can also have the recorded events later on. So watch that out and stay on this space. I'll be excited to have an interaction with you all, and yeah, till next time, have a good day or good night depending on where you are.